Compression stockings come in many different sizes. They come in small, medium, large, extra large. The way that we do our sizing for compression stockings is done by a chart. The compression stockings themselves come in a below the knee, a thigh high, and a pantyhose. So what we do is we take measurements at the ankle, the calf, the thigh, and the hips. Of course, you aren't going to take measurements at the thigh and the hips if you're giving somebody a below the knee stocking. There's different brands of stockings and different strengths. It'll be your anti-embolism stocking. That's going to be your strength that is between 12 and 18 millimeters. Then you go into the 15 to 20. That's this one right here that I have. It will say on the box, depending on the brand, it tells you different places. This one is a 15 to 20. This one's a Vitality. So this one looks more like a dress sock. So this one, so this is the Medi brand. It's their newest dress sock that's actually out. So this one works really well. The way that the compression stocking works is that the highest part is at the ankle. So on this one it's going to be 20 and it gradually goes up to the 15. So that's why it's so important when you take those measurements to use centimeters. That gives you a more exact measurement for the compression stockings. Then we have the thigh high. The thigh high actually goes 2 fingers below the bottom. So it's gonna go all the way up pretty high onto the patient. It's got a silicone border that helps grip, so that way you keep it from sliding down. And then last but not least, we have a pantyhose. If a patient is getting a 30 to 40, a prescription is required for that. A patient can come in at any time and get a 15 to 20, 18 to 22, 20 to 30. They can purchase that off of the shelf. Compression stockings are used for many different reasons. If they have swelling, edema, if they're on their feet a lot at work, if they have varicose veins, if they're traveling, all of these things the compression stockings help with. If you're looking for something for someone who wants a light compression because they have a little bit of swelling, you're going to look maybe closer to your 15 to 20, 18 to 22. If you have somebody who's on their feet all day, who has a lot of edema, maybe lymphedema, you're going to maybe look closer to your 20 to 30 or 30 to 40. When it comes to compression stockings, there's a couple different ways that you can put them on. The things that you want to remember as a tech when it comes time for you to help a patient put compression stockings on is you want to be able to talk with the patients and see how much movement they have in their hands. A lot of times you have your older clientele and they don't have the grip or the strength to pull up a stronger compression. They really kind of struggle with the 20 to 30s and higher compression. Otherwise, you have stocking aids. There's a couple different types of stocking aids. This one, you just take, so for the below the knee, you take it, open the stocking up, and it goes right over the top of it. You push that down. So that when the toe comes up, the patient would just simply put their foot in there, grab onto these, and pull up. A couple other ways, if the patient doesn't want to use a donning device, that you can do it is to help the patient. You can have them stick their hand down into the stocking, pinch at the heel, and pull through like this. Then they stick their toes right in here and pull up over the ankle. The hardest part on compression stockings is getting it over the heel. Once you have the stocking over the heel, pulling it up, getting it to the proper place is pretty easy. The things that you want to remember, if you have a below the knee, you want it to be 2 fingers below the bend of the knee. If it's a thigh high, you want it to be 2 fingers below their bottom. If it's a pantyhose, you want it to be up around their belly button. So you want to make sure that the patient can put these on and be compliant with them. So it's important to measure them while they're here and have them try on. When it comes to compression stockings, a lot of times if you fit a patient and then they give you a call and they say it's just way too tight, I can't get it on, we always recommend that they bring their stocking back in to show us how they're putting it on. If a patient brings the stocking back into you and says, this is what I'm doing, I can't get it up, they bunch it all down here, they've taken all of the compression out of the whole stocking and put it in one spot, which makes it really hard for anybody to be able to stretch that to get your foot into. Once the patient has the compression stocking on, you want to make sure that there's no folds or bunches in the fabric, because what that does is if the fabric is folded, it will actually compress on top of itself.